you have a hammer toe, you know how aggravating it can be, that it hurts in your shoes, and it's difficult to find shoes that don't hurt you. And you might have been to your doctor and they have told you that the only way to fix a hammer toe is with surgery, which is 99.9% true in most cases, despite what you might hear otherwise on the internet. So in certain patients in my practice, they might not be able to take the time off for healing after a hammer toe surgery. They might not want to pay their deductible for it. So in those cases, I have different types of little devices that I recommend to my patients so they can wear their shoes comfortably and perhaps put off surgery until they're ready. So in this episode, I'm going to share all the tips and tricks and secrets of the different types of devices that I recommend to my patients so they can be comfortable in their shoes with their hammer toes. Hey, it's Dr. Gaffney, saving you time and money in your foot health decisions. So the hammer toes, there's lots of different hammer toes. There's 4 biomechanical types, and then there's also flexible and rigid type hammer toes. And most of these devices work well with a flexible type hammer toe deformity. Some of the devices might work well with a rigid type hammer toe as well. The first type is a claw toe. So that's when your toes are clawed up like that. It looks like a claw. So the pain usually comes at the tip of the toe. So the different devices that offload that are called buttress pads or crest pads, hammer toe crest pads. And on my website, I carry some of these. So there's cork and leather type crest pad. And this is the most common classical crest pad. So the little loop goes underneath your toe. This is like your second or third toe, and then it holds up the toe so you don't get that pressure. It doesn't let it bend down and get the pressure at the tip. Now, this cork and leather may be too tough for some folks to tolerate. So there are these nice gel crest pads, and I love this gel by Dr. Jill's Foot Pads. It's very soft and has a real flexible hole there. This is where most of them break around this loop here, but this one's fairly rigid here. So the fat part goes towards the big toe and the tapered part goes towards the little toe. And then you just slide the second or third toe in there and it lifts them up. And then this other one is an adjustable loop. This loop stretches, but sometimes it's too constrictive for folks. But this little crest pad here has a still stretchy but soft fabric loop, and you can adjust it underneath here by pulling it like so. And so you can adjust it tighter or looser, but you just want to be careful you don't yank it too much underneath here, and that will get loose and won't work anymore. But so this adjustable one's real nice for that. Some of the reasons why these don't work for folks is that this elastic little band might cause too much pressure on the toe and create a pressure area. Likewise, this loop might cause some pressure too, might be too small for certain people. And of course, with diabetics and people with poor circulation or people with neuropathy, numbness, tingling in their toes, you need to check with your doctor before you use any of these types of devices. Now, if you're unlucky and you have a claw toe of all the toes in your 2 through 5 and the lesser toes, then sometimes this little gel comb might work out pretty well. You just put the little gel underneath all the toes there, and it lifts them up, and it works real nice. It kind of acts like a toe spacer. And this is the real soft gel from Dr. Jill's Foot Pads. Also, these gel pads can be cut to fit. If it feels like it's too thick or you want to bevel it, you can cut it with scissors. Also by Dr. Jill's Foot Pads are these single crest pads. So if you just have one toe that's a claw toe, and that can be maybe after a trauma, you might have one toe that's a claw toe. This will just go on one toe, so you just slide it underneath the one toe and it holds it up so you don't get that pressure at the tip. Also, it can be used as a spacer between toes. You just slide the loop like that, and it'll keep it away from the other toes. So in general, crest pads, anything that's going to try and manipulate your toes straight to realign it, you need to have a flexible type hammer toe. So anything that you can take your finger and then stretch it manually straight, we call that a flexible type hammer toe. And that can be manipulated with things like splints and not cause pain. If by chance you have a flexible claw toe deformity, meaning that you can take your finger and stretch that toe out and you have a tight flexor tendon, there is a procedure that works great for that type of problem with minimal pain, minimal downtime, and it's done in the office. And you're back on your feet within a week. If you're interested in that, check out my episode on it. So if you're rigid, if you can't straighten out your toe, then those crest pads or anything that's going to realign the toe is not going to work and potentially can cause more pain for you. So in that case, I would recommend a toe sleeve or a toe cap just to kind of cushion the toe in the shoe so it doesn't irritate and cause pain. So one nice gel toe cap is this gel toe cap by Dr. Jill's Foot Pads. So you can just slide it on the toe. This is like an excellent gel that'll help cushion your knuckles and also at the end of the toe, and that'll help with the rigid claw toe deformity. There's also this fabric gel cap by Pedifix. There's gel all along the inside of this cap here, so it'll cushion the end of the toe and the whole toe in general. And so you just slide it over the toe like that. It'll cushion the end and then also the knuckles so you don't get pressure, knuckle and tip. A lot of people have pressure also at the top of the knuckle in the shoes as well as the end from the claw toe. So both of these work really well with any type of hammer toe if you're getting a lot of friction like redness at the knuckles or at the tip. Again, the same warnings if you're diabetic, poor circulation or neuropathy, you want to check with your doctor. You don't want to use any of these products over broken skin or wounds. My next main go-to product for hammer toe relief are these felt corn pads. So we call them felt corn protectors, and they have this little hole and it's adhesive felt. These work much better than over-the-counter foam corn protectors because the felt offloads a lot better. So the corn goes in the center here and it just takes pressure off of the sore part there, the knuckle that's rubbing in the shoe or the corn. So sometimes this little hole is not big enough, so what I do is I just cut it a little bit on the edges here. It'll expand a little bit more for a bigger corn pad. You can also cut the hole bigger for a larger type corn or knuckle if you have like a arthritic knot. These stick pretty well, but sometimes I'll use a paper tape to kind of secure it on the toe so it stays longer. With anything adhesive, I tell my patients not to leave it on the toe or the foot more than a day or two because it'll start to irritate the skin or make it turn white and have it start shedding off and you can get a wound. So you don't really want to wear this too awful long on the skin. You gotta let your skin breathe. The other product that's super nice for hammer toes is this gel tube by Dr. Jill's Foot Pads. Again, it's this really nice gel that they have and you just slide it over your toe. This is more for the big toe, but there's smaller sizes you can get and you just put it on. It'll take pressure off of all the bony prominences with this nice silicone. The silicone will release mineral oil and it'll soften the skin and the corn so that it's not so hard and tough, and that's another good use of using a gel type product. For the baby toe, there are little tiny mini tubes. The baby toe especially turns and gets a lot of shoe pressure, so these little silicone mini tubes are great for hammer toes of the fifth toe where they get all the shoe pressure. Another great pad for a hammer toe on the fifth toe is this Silipose little corn pad. It's fabric and it has this nice little dot of silicone. It's extra thick. And this is great for baby toes for cushioning in the shoes. Lastly, if you have a hammer toe that's sticking up in the air, so it's elevated off the ground, not touching the ground, these little Budin toe splints can help with that. That's only if they're flexible, if you can take your finger and pull the toe down easily these will help. You just slide the toe right through that loop and it holds it down. These are also good for after a injury where you have like a hyperextension and the plantar plate underneath there is injured. This will hold it down. It can help after a toe fracture as well and after surgery for healing, a hammer toe surgery. Now with these, you want to make sure this loop is at the base of the toe and not at the knuckle. If it goes up to the knuckle, it's going to rub and hurt the knuckle. I've carried all these products in my store. If you're interested, you can go check out my store at drgaffneybestfoot.com. And they're curated from all the companies that I know and trust and have used throughout my career, like Silopost, Pedifix, Dr. Jill's foot pads. Hey, if I've given you some value, if I've helped you at all, please like and subscribe to my channel. I'd appreciate that very much.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.